I'm Tiffany. I'm one of the nurse practitioners here in the clinic.
I'm Mike.
And can you tell me what your name and date of birth is?
Mike Atkins, 12/15/73.
And what would you like me to call you? Your first name, last name?
Michael Retard.
All right. And what are you here for today?
Just a general checkup.
Okay. All right. So today we're going to be doing a comprehensive physical assessment and health history. I'll be asking you a series of questions and doing some exams. Is that okay with you?
Yes.
All right. For the purposes of this exercise, the patient's height and weight has been obtained off of camera, as well as portions of his history. And the patient's height is 6'3", and his weight is 243 pounds. And I will begin by washing my hands. And we're going to now obtain some vital signs. So I'm going to have you put this under your tongue. Okay, your pulse is 140/82. Temp is 98.6. I'm going to count your respirations and your heart rate. All right, heart rate is 90 and respirations are 16. General appearances that the patient is relaxed, he's well appearing, he's well kempt, and he's expressive when he speaks. I'm looking at his skin color here. It's normal for ethnicity. I'm checking his skin turgor, and it's got elastic recoil. I'm also looking to see his skin is intact. I don't see any bruising. I don't see any abrasions or any kinds of lesions, and it's also clean. I'm palpating his arms and legs. I don't feel any edema. The skin is moist, it's not dry. And then I'm going to do a mental exam on the patient. Can you tell me where you're at right now, sir?
At the health clinic.
Okay, and what's the date today?
November 29th.
And what time is it?
The time is 7:16.
And who's the President of the United States?
Donald Trump.
All right, I'm going to just give you this piece of paper here with a clock on it. And I'm going to have you draw a picture of a clock. And you just tell me when you're done.
Done.
Okay, I'm going to give you 3 words, and the words are copper, penny, watch. And I want you to repeat those words, and I'm going to ask you what those words were in just a few minutes. Copper, penny, watch.
Copper, penny, watch.
All right, the next thing I'm going to do is I'm going to palpate your skull. I'm looking at your head. I see that your head is normocephalic, and I'm going to palpate to see if there's any masses, bumps, any kinds of lesions. I see that your hair pattern, you've got some androgenic alopecia. I also see that you don't have any lumps, bumps, bruising, or masses in your skull. And then the next thing I'm going to do is look for infestations. I don't see any infestations in your hair. The texture of your hair is soft and it's shiny. I'm also going to palpate your sinuses. Any pain?
No.
Any pain?
No pain.
All right, I'm going to have you clench your jaw. Any pain?
No pain.
Open your mouth. Any pain?
No pain.
I'm palpating for TMJ. I don't feel any clicks, no pain from the patient. I'm also going to have the patient open his mouth against resistance. All right, close your mouth. And I'm also going to assess his stimuli with a sharp and dull object. Please close your eyes and tell me if this is dull or sharp.
Dull.
It's one of them's going to be soft and one of them's going to be dull.
Sharp.
One of them's going to be dull and one of them's going to be soft. This is going to be dull, and this is going to be soft.
Okay. Dull, soft, dull, soft.
Okay. All right, so I'm just checking his sensory, and I see here on his forehead that when he felt the softness, he was able to distinguish between those two things. Cranial nerve 5 is intact. His head was normal cephalic, no tenderness, no lumps, no bumps. Hair pattern was normal. His facial features were symmetrical, and he was negative for his sinus pain. The next thing I'm going to do is have you wrinkle your forehead, close your eyes tight. You're going to smile and show me your teeth, and open your eyes. And you're going to puff your cheeks out just like you're blowing. Okay. And he's able to do that, so that tells me that cranial nerve 7 is intact. I also want you to stick out your tongue, move it side to side, and cranial nerve 12 is intact. And I also looked at his face, and everything is symmetrical. Eyes is symmetrical, nose is symmetrical, ears symmetrical, and that tells me he doesn't have any drooping, so cranial nerves 5 and 6 are intact. The next thing I'm going to assess is your ears. So I'm going to inspect your ears, and I see where they're both symmetrical and they're aligned properly in proportion with your head. I'm also going to palpate your ears. Any pain?
No pain.
Okay. No tenderness. I don't feel any lumps or bumps or abrasions or anything like that on the ears. No masses. And I don't see any discharge. So the next thing that I'm going to do is we're going to do what's called a whisper test, and I'm going to have you close up one of your ears, and I'm going to whisper a couple of words behind your ear, and I want you to repeat those words to me, okay?
Okay. Apple, banana. Orange, pineapple.
Okay, good. You passed that. He was able to repeat all 4 of the different words to me. So the next thing we're going to do is a Renee test. So this is a tuning fork. I'm going to hit this. It's going to make a loud buzzing noise. And I want you to tell me if you can hear this noise and when you don't hear it anymore. Can you hear it?
Yes.
All right. And did it go away?
Yes.
Okay. And then I'm going to hit it again. Can you hear it?
Yes.
Okay. And which one was louder?
The second.
Okay. And I'm going to hit it again over here. We're going to do the same thing. Okay, can you hear it?
Yes.
All right, and we're going to do the same thing on the bony prominence behind your ear. Can you hear it?
Yes.
Which one was louder?
The second.
Okay. All right, the next thing we're going to do is a Weber test, and I'm going to do the same thing, only I'm going to put the tuning fork up here and also here, and you're going to tell me if they're both the same. Did you hear one better than the other, or were they the same?
The same.
Okay. All right, so the next thing that I'm going to do is, because of the, let's see, he was able to hear all of those different tests, so cranial nerve 8 is intact. So the next thing I'm going to do is use the otoscope, and I'm going to look inside of his ear. So I'm just going to pull up on the pinna. No tenderness when I pull up. If he had inflammation inside the ear, then it would be hard for him, and it would be painful for him for me to pull up. When I'm looking inside the ear, I see a little bit of cerumen inside the cavity. The cavity is normal. The canal is normal. The eardrum, the tympanic membrane is intact, and it's pearly gray. We're going to look in the other ear. When I pull up, any tenderness?
No.
All right, just a tiny bit of cerumen in the canal, but I see where the eardrum is pearly white, and the tympanic membrane is intact. All right, so the next thing we're going to do is the eyes. And I'm going to inspect the eyes. I'm looking at the eyes for symmetry. I'm looking at the sclera, and I see where the sclera are china white. I see where there's eyelashes, they're intact, and that the eyes are glossy and shiny. I'm just going to look at the conjunctiva, and the conjunctiva are pink and moist, no signs of infection. The next thing we're going to do is a Snellen chart. This is going to check your visual acuity. I'm going to have you hold this out in front of you, and I'm going to have you read the smallest line that you possibly can read, and I'm going to have you cover one of your eyes while you do it.
LTF PH.
Okay, great, perfect. Okay, switch eyes.
LTF PH.
Okay, perfect. This patient has 20/20 vision. This patient is able to see normally what a patient that can see regularly at 20 feet could see. So that means that it's 20/20. I'm also going to check your visual fields. So I'm going to have you cover up one eye. And I'm going to hold up some fingers, and I want you to tell me how many fingers I'm holding up.
2,
You're going to be focused right here on my nose.
2, 2, 2, 2,
Okay, cover the other one. Okay, and focus on my nose.
2, 2, 2, 2.
Excellent. So all of this fields of visual fields are intact, and this tells me that cranial nerve 2 is intact. We're next going to do the cardinal fields of gaze and looking for extraocular movements. So I want you to focus on this pencil right here. Okay. Don't move your head. Okay, all of the cardinal fields of gaze are intact, and that tells me that that cranial nerve 6 is intact. We're going to now assess the pupils using an ophthalmoscope. So we're going to be looking for pupillary reaction. Okay, the pupils are perla. They are 2 millimeters and they are brisk, reactive to light. And the next thing that we're going to do is we're going to look inside of the eyes with the ophthalmoscope. And I see that the optic red reflex is intact bilaterally, and the optic disc is round with sharp margins and creamy pink. The retinal vessels are intact and bright red without any kind of signs of inflammation. Hemorrhage macula is positive for foveal light reflex. The next thing we're going to do is assess the nose. So I'm just looking at the nose. The nose is midline. I don't see any signs of septal deviation, and we're going to look inside of the turbinates. Okay, I see where there is still no sign of septal deviation, and I also see where there is no turbinate hypertrophy. I also see where the internal canal is cherry red. And the next thing we're going to do is test for the olfactory. And I'm going to have you close up one of your nostrils and close your eyes. And I'm going to put something under your nose for you to smell it, and you tell me what you smell. 1, 2, 3. Smell.
Peppermint.
Okay, and close the other nostril. Smell.
Peppermint.
Are you able to breathe equally out of both of those nostrils, or did one feel clogged?
Both the same.
Okay, so bilaterally the nares are both patent. So that tells me that cranial nerve 1 is also intact. So the next thing we're going to do is there's no olfactory deficits. So we're going to look at the throat and the mouth next, and we're going to inspect the mouth first. So I'm going to have you open your mouth, and I'm just looking at the buccal mucosa, I'm looking at the teeth. I'm going to take a light here and a tongue depressor. I'm just going to compress the tongue, and we're just going to look inside of the mouth, and I see where the mouth is moist pink, the tongue is bubblegum pink. I see where the dentition is intact, no dental caries, the wisdom teeth are intact. I also visualize bilateral tonsils. The tonsils are bilaterally equal without exudate, no swelling, and symmetrical. They are within normal limits. The uvula is normal. It's midline and pink. I also see that the patient, when he spoke earlier, he was negative for hoarseness. And I also see where the patient's gag reflex is also intact. And I'm going to have you say ah. All right. And the soft palate moves when he says ah. All right. So the next thing that I'm going to do is have the patient drink some water, and while he drinks the water, I'm going to palpate his thyroid for nodules to see if there's any kind of deviation when he swallows, as well as any nodules. Tiny sip. Okay, and I didn't feel any deviation there, nor do I feel any borders or nodules on the thyroid. And so whenever he said ah, and I was able to check his swallowing, I was able to check cranial nerves 9 through 10. So the next thing we're going to do is check the neck. I'm going to palpate his lymph nodes. So, let me come over here. You want to just turn your head a little bit. Trying to move to the camera. So this is going to be his preauricular, his postauricular, his occipital, his cervical, his submandibular, and his submental. And I don't feel any lymphadenopathy at all. I'm also going to have him move his head towards resistance. Okay, he's able to move resistance. I'm going to have you try to move your head down against resistance, and he's able to move it. Can you please move your head up, down, side to side? Any pain?
No, ma'am.
Any difficulty moving?
No difficulty.
I don't hear any kinds of clicks or any kinds of cracking whenever he moves his neck. He's got full range of motion. And now I'm going to have you shrug your shoulders against my hands. All right. And I see where cranial nerve 11 is intact. The next thing I'm going to do is listen for carotid bruits to see if there's anything in his neck. And he is negative for bruise. So the next thing I'm going to do is have you come and lay back over here. And I'm going to be palpating his point of maximal impact, the PMI for the heart. All right, and the next thing I'm going to do is auscultate all of his valves, his mitral, tricuspid, pulmonic, and aortic. S1 and S2 were auscultated, and the patient is negative for all murmurs and all valves. The next thing I'm going to do is check for jugular vein distension. I'm going to have you lean back, sir. Turn your head to the side. And he's negative for jugular vein distension on the right, and I'm going to have you turn to the other side. And he's negative for jugular vein distension on the left. I'm going to have you sit up, sir. All right, and the next thing that we're going to do is we're going to look at the lungs. So I'm going to assess for the lungs. I'm going to have you take a deep breath. All right, I'm going to have you lean your shoulders forward, take a deep breath. Lean your shoulders back, take a deep breath. Raise your arms, take a deep breath. All right. So I see where he's not barrel chested. I see where he's not using any of his accessory or intercostal muscles. His breathing is not labored. It's even and it's regular. And now I'm just going to listen to his lung fields. Breathe regular. Okay. Breathe. 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 And I'm going to have you raise your arms. Take a deep breath. Good. All right, these lungs are clear. And then I'm going to listen to the posterior. Breathe. Breathe. All right. So I haven't noted any scars on his chest. I haven't noticed any kind of wheezing. There's not been any kind of coughing. His lungs are clear and no consolidation noted. So the next thing we're going to do is test for tactile firmitus. So whenever you feel my hands touch your chest, I want you to say the number 99.
99, 99, 99, 99.
Okay, we're going to do it again on the back.
99, 99, 99, 99, 99.
I'm gonna have you lay back against the mattress and we're gonna assess for your abdomen. I'm gonna be looking for your abdomen. The abdomen is flat and soft. I also don't note any scarring at all on the abdomen. And then the next thing I'm gonna do is auscultate all 4 quadrants. I'm gonna be listening up in the top center for an abdominal aortic aneurysm. I do not hear anything. Listening for bowel sounds. Okay, bowel sounds are present in all 4 quadrants. I'm also going to palpate any tenderness.
No pain.
Okay, patient is negative for guarding, he's negative for tenderness, he's negative for hepatomegalia, and he's also negative for splenomegalia. So the next thing that I would do is, if it was appropriate for the patient, I'll go ahead and have you sit up. Scoot to the edge of the bed. I would do a urogenital, rectal, vaginal, or exam depending on the patient's sex if it was appropriate for the visit, but this patient is up to date on his screenings and that's unnecessary at this time. So the next thing that I'm going to do is do a musculoskeletal check. So I'm going to have you close your eyes. And I'm going to have you tell me if this is sharp or dull.
Sharp. Dull. Sharp. Dull. Sharp. Sharp. Dull. Sharp. Dull. Sharp. Dull.
All right. The patient's sensory is intact and he's able to feel sharp and dull. So the next thing I'm going to have him do is stand up. And I'm going to have you walk in the room. His gait is even steady and his balance is equal. Okay, I'm going to have you come over here. I'm going to have you bend at the waist and I'm going to assess your spine. I don't see any curvature of the spine. Okay, stand up. I'm going to have you put your foot to your shin. Okay, balance is good, no ataxia. Put your foot to your other shin. All right, balance is good, no ataxia. I'm going to have you hold out your arms in front of you. Okay, close your eyes, turn your hands over, and the patient is able to hold his hands out without losing his balance. Okay, put your hands down, and he was able to hold them up against resistance. So don't let me knock you over. Patient is able to stand up without being knocked over. All right, go ahead and sit back down on the bed. The next thing we're going to do is assess your reflexes. So I'm going to come and do your brachiocephalic reflex. Okay. 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 And we're going to do your patellar. Okay. Patellar. Achilles. Achilles. All right. I'm just going to check your fingers for clubbing. Okay. Capillary refill is less than 2 seconds. On the toes as well. No swelling noted and no clubbing or edema. He is normal. His hair is normal. And then I'm also, just tell me if if I pull your toe up or down.
Up.
And your finger up or down.
Up.
All right. And so the proprioception is normal. I think that concludes our assessment. Thank you.